All right, today we're going to talk about something that's actually remarkably simple, but also incredibly powerful. It's a technique that uses one of the most basic forces in the universe to help people breathe easier. It's called postural drainage, and you're about to see it's all about finding the right angle. So, how can gravity actually help you breathe? I mean, it sounds a little too simple, doesn't it? We usually think of breathing as this super complex biological thing. But what if one of the best ways to clear out your lungs was just changing how you're sitting or lying down? Let's dive in and find out. So, first things first, what exactly is this technique? At its heart, it's really just applying some simple physics to our own bodies to help us feel better. Here's the big idea. When your lungs get filled up with that thick, sticky mucus, what doctors call bronchial secretions, it can be a real struggle to get it out. So postural drainage uses very specific body positions to let gravity do the heavy lifting. The goal is to get that mucus to flow from all the tiny little airways deep in your lungs into the bigger ones, where a good, strong cough can finally get it out. This analogy is just perfect. It really captures the whole idea. You'd never try to get the last bit of ketchup out by holding the bottle straight up, right? No way. You tip it, you turn it, sometimes you even have to turn it completely upside down to let gravity work its magic. Well, our lungs are pretty much the same. We just need to figure out the perfect angle to get things moving. And the goals here, they're crystal clear. Getting that gunk out isn't just about feeling less congested. It actually frees up space for air to move in and out. That means better ventilation, which leads to better gas exchange. And that's the really crucial part, getting oxygen into your blood. It's also a huge deal for preventing complications, especially after surgery when people aren't moving around much. So who is this actually for? Because as great as this technique is, it is not a one-size-fits-all kind of deal. It's a very targeted therapy, and knowing who it helps, and maybe even more importantly, who it's not for, is absolutely critical to doing it safely. For some people, this therapy is a total game changer. We're talking about conditions where the body produces a lot of really thick mucus, like cystic fibrosis or bronchiectasis. It's also super helpful for more short-term problems like pneumonia, or for patients who have been on bed rest for a long time and just can't clear their lungs naturally. Basically, if you've got mucus that's stuck, this is what's designed to get it unstuck. Now there's another level here. These are the situations where you have to be really, really careful. You need a professional supervising things. For example, if someone has osteoporosis, the clapping on the chest that sometimes goes with this could actually risk a fracture. And for other people, those head-down positions can mess with their blood pressure or put a strain on a recent surgery. So caution is key. And then you have the absolute stop signs. This is where we have to be completely 100% clear. Some conditions call for caution, but these next ones, they're a total no-go. This isn't about weighing the pros and cons. It's about avoiding a very clear danger. Look, if any of these things are going on, postural drainage is just completely off the table, no questions asked. Coughing up blood, for instance, could make an active bleed even worse. And trying to tilt someone who has a recent spinal injury or really high pressure in their brain is incredibly dangerous. These are what we call absolute contraindications. Okay, so we've covered the what, the why, and the who. Now let's get practical. How does this actually work? How do you use gravity to your advantage? Well, it's a mix of a few core principles and some very specific positions. It really boils down to 4 golden rules. First, obviously, is the positioning, letting gravity do the work. But the timing is just as critical. You don't want to do this on a full stomach. That's just asking for discomfort. You also have to hold each position long enough for gravity to actually have an effect, usually about 5 to 10 minutes. And it all wraps up with controlled breathing and coughing to actually get the mucus out. The positioning itself is actually super logical once you think about it. Picture your airways like an upside-down tree. The very top branches, what we call the apical segments, are already pointing up. So to drain them, you just have to sit upright. Gravity does the rest, pulling mucus down into the bigger branches. Easy enough. So what about those middle branches, the ones coming off the main trunk at an angle? Well, you have to match that angle. This usually means lying down and propping up the foot of the bed maybe about 15 degrees or so. You're just tilting that whole tree enough to let gravity drain those specific middle sections. And then to get to the very bottom of the lungs, where the lowest branches are, you need the steepest angle of all. This is where you might tilt the bed up to 30 degrees, putting you in a pretty significant head-down position. This lets the mucus from those lowest parts flow uphill, so to speak, back towards the larger airways to be coughed out. But just changing your position isn't always enough, especially if the mucus is really thick and stubborn. That's why postural drainage is usually part of a team effort. A therapist might use percussion, that's a firm, rhythmic clapping on the chest, to literally shake the mucus loose. Then vibration helps kind of shimmy it along. And finally, a good huff or cough is the final push that gets it all out. So we've seen how effective this can be. But with any medical treatment, it's so important to look at the whole picture. You've got the powerful benefits on one side and the potential risks on the other. On the one hand, the advantages are huge. You get better mucus clearance, a lower risk of infection, and you just feel like you can breathe better. But there are definitely trade-offs. The positions can be tiring and pretty uncomfortable. That head-down angle can trigger acid reflux. And for some patients, it can cause a temporary dip in their blood oxygen or even a rise in pressure inside the skull. That's exactly why having a professional monitoring you is so important. Okay, so let's bring it all home. After looking at the science, the how-to, and the risks, what are the most important things to remember about postural drainage? What really matters? Well, first thing to know, this is a commitment. A full session going through all the different positions you need is going to take somewhere between 30 and 45 minutes. It's a real therapeutic procedure, not just a quick fix. This quote from our source material just hits the nail on the head. It says it all, really. Success isn't just one thing. You absolutely have to get the angles right. You need a patient who's on board and can cooperate, and you need to combine it with those other techniques, like percussion and coughing. It's the combination of all three that truly makes it work. And that leaves us with this final thought. In our world of super high-tech medicine, isn't it just fascinating that one of the most effective ways to clear the lungs comes down to a principle we all learned about in grade school? It really makes you wonder, what other simple, powerful tools are we overlooking in our search for better health?